I thank the senator from Mississippi. And Mr. President, I ask unanimous consent that several of my colleagues and I may engage in a colloquy during the time we have.
Without objection.
Thank you. And Mr. President, I'd like to follow up on the comments of Senator Wicker from Mississippi because it's very critical that the American public understand what has just happened in the Senate. When you talk about health care reform, the vast majority of Americans have a couple of ideas in mind. First and foremost, they want to lower health care premiums and costs. That's what Americans think about primarily when they think about the need for health care reform. They also want to see better access to quality health care and make sure that those who are uninsured have access to health care and those who are underinsured have access to health care, and that we all have access to quality health care. That's what this debate should be about. But instead, the legislation that we see before us does not achieve that. Does it reduce the cost of health care? No. It drives up the cost of health care. It raises taxes, hundreds of billions of dollars. It cuts Medicare by hundreds of billions of dollars. It grows government by $2.5 trillion of new spending. It forces the most needy in our society into a failing Medicaid system. It imposes a damaging unfunded mandate on our struggling states. It still leaves millions of Americans uninsured and establishes massive government controls over our health care economy, including even the creation now of a government insurance. We have been focusing in the debate on one part of this for the last little while, and that is the Medicare cuts. $464 billion of the revenue to pay for this massive new entitlement that is being created are to come from Medicare. And it's nothing other than a direct transfer of assets in the United States from America's seniors in the Medicare system to a new government entitlement program. There are other cuts, there are details to these cuts that I'll put up right now. And the debate that we've been having over the last almost 3 or 4 days now is whether we should recommit this bill back to the Finance Committee so that these Medicare cuts can be removed. We just had 2 votes. One is what I will call a cover vote. It said we don't want to cut Medicare benefits and we should make sure that anything we do protects Medicare. Didn't have any detail in it, but it passed 100-0 because it does nothing. It doesn't change what is in the bill. The second vote that we just, and by the way, like I said, that vote just passed by 100-0. The second vote we just took failed. Was the vote 60-40? I don't recall the exact vote. Failed, 60-40. What would that amendment have done? That would have put the bill back into the Finance Committee and required that we take out the Medicare cuts. So let no one be confused. After the first round now in the Senate, we still see this in the bill. A transfer of $464 billion from the Medicare program to the establishment of a new entitlement program. I don't believe that that's what Americans had in mind when they were talking about reform of health care. Now, there's been a study come out. Okay, I've got the exact vote here. It wasn't 60-40, it was 58-42. But it was defeated in any event. And now we still have the cuts to Medicare in the bill. Well, we're going to continue debating this issue. I myself have an amendment that will send for the skilled nursing homes the bill back to finance to correct the cuts for their skilled nursing homes. There are others who will try to address some of the pieces of this to see if we can't find a way to fix and restore the strength and stability of the Medicare system. Now, everyone admits that we need to reform Medicare. But until this bill, none of us thought we were talking about taking from Medicare in order to create a massive new entitlement program with the government control that comes along with it. What do these cuts do? I'm going to start out with the hospitals, the hospices, the nursing homes, and the home health agencies. The reduction in Medicare spending on these medical providers will basically result in lower access to our seniors to care. I've had representatives in my office of both skilled nursing facilities and home health agencies who have talked to me about what this means to them. They pointed out that the last time Congress did something like this, we lost in Idaho 30%, for example, I believe it is, of our home health agencies. They're just not there anymore. And if we have these kinds of deep cuts in the future, we're going to lose more of our home health care agencies. What one of the owners said to me is, he put it to me this way. He says, if you reduce the allocation of income to home health agencies, I have to either reduce employment, which means not hire as many nurses and medical providers, or I have to close parts of my building and stop operating as many rooms in the building, or do something to reduce cost. What that means is seniors will have less access. But that's not all this bill does. In addition to reducing the access for hospitals, hospice service, nursing homes, and home health agencies, it also cuts Medicare Advantage deeply. Now, quickly, what is Medicare Advantage? Medicare Advantage is a program that about 1 out of 4 American seniors participate in Medicare. It is an opportunity which Congress started a few years back to try to let the private sector become a part of the delivery system in Medicare. In other words, to put it simply, private sector insurance companies can contract with the federal government to provide Medicare services to Medicare beneficiaries, so that it's the private sector getting involved in the health care delivery rather than the government simply delivering the health care through a single payer system. And that, in a quick summary, is what Medicare Advantage was all about. What we found is that it was phenomenally successful because the private sector was able, through its management, to not only provide the statutorily required Medicare coverage, but additional benefits. Very critical additional benefits like preventive health care, dental coverage, vision coverage, and things like that. Things that make a big difference in the lives of our seniors and enable some of those who can't buy additional Medicare coverage for those things that Medicare doesn't cover to get access to it through Medicare Advantage. That's why in my state, 27% of all of the Medicare recipients have moved to Medicare Advantage. It's the most popular part of Medicare in America today, and it's growing faster than any other part of Medicare because it's delivering more to the Medicare beneficiaries. Well, this bill slashes $120 billion from it. Some of us believe because there is a bias against the private sector delivery of health care, but for whatever the reason, the Medicare Advantage portion is where the cuts are focused. Now, let's put up the next chart. When we had this issue before the Finance Committee, we had the head of CBO before us, and I asked him a question about the cuts to Medicare Advantage. My question was, we had a colloquy between us at that point, and I said, so approximately half of this additional benefit, in other words, these additional things that Medicare Advantage has been able to provide to our seniors under Medicare, so approximately half of the additional benefit would be lost to these current medical advantage policy holders. And his response was, for those who would be enrolled otherwise under the current law, yes. The point being, not only will we lose skilled nursing facilities, home care, hospice care, and hospital care, and access to that care, we are also going to see senior citizens lose benefits. And again, what is the purpose? The purpose is not to shore up Medicare. In fact, it will take $464 billion, taxpayer dollars that are allocated to Medicare in our current system, and transfer them straight over. Let's go back to that chart with the picture. Transfer them straight over to the establishment of a new entitlement program. And I want to let my colleague from Nevada comment on this for a minute, but before I turn it over to my colleague from Nevada, I would like to just point out that as we approach this issue, the question of why would we transfer $464 billion out of the Medicare system to a new government entitlement program, One of the reasons is because the president pledged that he wouldn't sign a bill that didn't reduce the deficit. As I said earlier, this bill grows the spending in the federal government by over approximately $2.5 trillion over the first full 10 years of its implementation of spending. The only way to cover that increase in the size of the government is to either raise more taxes or to cut spending somewhere, and what this bill does is both. It raises taxes, which we're going to be talking about in future days, and it cuts spending. And the place where it cuts spending is Medicare. And that's why what we see is increased taxes, cuts in Medicare, growth of government, and the establishment of a new federal entitlement program with all of the accompanying accoutrements of federal control, including a new government-owned and operated insurance company. And now I see my colleague from Nevada standing and would turn to him for his comments on this issue.
Well, first of all, I think my colleague from Idaho has made some excellent points about truly the cuts that are going to happen in Medicare. And, you know, don't take the politician's word for these cuts. Listen to the CBO director. He's a nonpartisan official scorekeeper. And when asked direct questions by not only a senator from Idaho, but others, he absolutely says the benefits, especially under Medicare Advantage, will be cut. In my home state, tens of thousands, I think about 200,000 altogether, seniors in the state of Nevada have voluntarily chosen Medicare Advantage over traditional Medicare. The reason? Very simple. There's extra benefits. You hear the Democrats talk about this donut hole, this on the Part D Medicare, which is prescription drugs. Well, there is no donut hole under most of the Medicare Advantage plans because the private sector, through its efficiency, has been able to fill that donut hole. In other words, they get complete coverage with prescription drugs. But they also, under Medicare Advantage, they get additional preventative health care services. They also get vision, dental, and depending on the plan, depending on its makeup, they put different types of benefits in to attract seniors to their plan. It's no wonder that about 1 out of 4 seniors in America have voluntarily signed up for Medicare Advantage. Nobody forced them into this system. They voluntarily chose this system. And if you think about it, you know, seniors don't like change. Most seniors, they like what they have. They don't like to change. And for 1 out of 4 seniors to have voluntarily changed, there has to be something pretty attractive about Medicare Advantage. Well, there are some real attractive things. And that's why when you actually poll seniors on Medicare Advantage, the vast majority of them are thrilled with their coverage. They don't want to lose benefits. Who would want to voluntarily lose benefits? But under the $120 billion cut in Medicare Advantage that the Democrat majority has put in this bill, about half of Medicare Advantage plans, about half of the benefits will be cut. Isn't that correct? I would ask my senator friend from the state of Idaho.
The senator from Nevada is correct. In fact, I'm just thumbing through here to get the exact statistics. But the bottom line is that the CBO indicated, I think that it was something like from an average number of $140 or so of extra benefits, it would go down a little, about half of that. So they get about half of those extra benefits.
And that's a per month.
That's per month.
$140 per month. About half of those benefits would be cut, according to the CBO, under this plan. Isn't that correct?
That's correct.
If the gentleman would yield on that point.
I'd be happy to.
We have 3 Republicans standing now saying this, and you've quoted some official independent sources. Let me quote a Democrat. Representative Michael McMahon of New York says, and I quote, Medicare Advantage, which serves approximately 40% of my seniors on Medicare, would be cut dramatically. And that's why that Democrat from the state of New York voted no on the plan when it was before the House of Representatives. So you don't have to take our word for it from a partisan standpoint. Democrats are saying no because of the Medicare cuts and the cuts to Medicare Advantage. Well, drastically cut.
The senator from Idaho and I, we both serve on the Finance Committee, where most of this bill, or a lot of this bill, was written. And we both heard Democrats on the other side of the aisle complaining about the cuts to Medicare Advantage. And yet when I look in the bill, the total dollar figure in cuts of Medicare Advantage is the same as what it came out of the Finance Committee. Isn't that correct?
The senator from Nevada is correct, and I have in front of me the exact numbers right now from CBO that were provided in the Finance Committee markup. During the markup, the CBO estimated that the value of the extra benefits offered by Medicare Advantage plans will drop from $135 a month to $42 a month, based on the cuts contained in that bill, which are essentially the same level of cuts that we now see in the bill before us on the floor.
Well, let me just make a couple other points in general about this bill. I think we've covered pretty well that Medicare Advantage is going to take a pretty severe hit. Medicare overall, hospice care, hospital care, nursing home care, home health, all of them are taking pretty severe cuts. And, you know, those cuts are going to come from someplace. And most likely those cuts are going to come if the government doesn't rescue those cuts in the future. Those cuts are going to come from benefits to seniors. Now, if the government decides to not have those cuts in the future, then the deficit's going to go up. You can't have it both ways. You can't have a deficit, quote, deficit neutral bill and not have the cuts in Medicare. In other words, you're going to either have the cuts in Medicare or you're going to have the deficits ballooning into the future. There are several other problems with the bill. I just want to make a couple other general points about this bill. First of all, we know it's over 2,000 pages. Incredibly complex language in that over 2,000 pages. It places bureaucrats all along the line in charge of health care decisions instead of a patient-centered health care system that says the doctor-patient relationship is where most of the health care choices should be made. As a matter of fact, in this bill, according to the National Center for Policy Analysis, almost 1,700 places it authorizes the Secretary of Health and Human Services to make, and I quote, create, determine, or define things in this bill regarding to health care policy. 1,697 times to be exact. The Secretary of Health and Human Services basically makes health care policy. Not doctors, not health care providers, bureaucrats in Washington, D.C. You mentioned before that there were $500 billion in new taxes, about $500 billion in Medicare cuts. We know that this bill will lead to millions of Americans having their premiums increase. Well, we've talked a lot about what's wrong with the bill, and many on this side of the aisle have offered positive solutions. We've talked about, let's allow small businesses to join together to take advantage of purchasing power that big businesses have. We talked about, let's allow people to buy insurance across state lines. Some states it's cheaper than others. You can buy your auto insurance across state lines. Why shouldn't we be able to buy our health insurance across state lines?
If I could just interrupt there. My understanding is that when the Republican bill in the House, which had those ideas in it, was evaluated by experts as to what it would do to the cost of health care and health care insurance premiums, that those ideas would actually reduce health care premiums by, I think, 5 or 6 or 8%. I don't remember the exact number. But the point is that those ideas would hit the reason that Americans want health care reform, and that is reduce the cost of health care coverage.
I'm glad you made that point, because the number one problem with health care in the United States is not quality. We have the finest quality by almost any measure, the finest quality health care system in the entire world. It's just too expensive. So we should be going after cost. This bill doesn't do it. It actually raises premiums for tens of millions of Americans. That isn't the direction that we should be going. Another place that the vast majority of people on this side have supported is medical liability reform. The CBO has said once again in the Finance Committee, we asked the question, I personally asked the question of the CBO director, how much money would the medical liability reform, the common one that I've offered, the Senator Hatch has offered, how much would that save between the public, between the government and the private sector? He said over $100 billion. Well, that's not chump change. That's a significant amount of money, $100 billion. Adding that to buying across state lines, adding that to small business health plans, incentivizing healthy behaviors, I think we can all agree we should eliminate pre-existing conditions. I think that's Republican, Democrats, everybody agrees. If you've had insurance, you've played by the rules, you get a disease, we should eliminate pre-existing conditions. We shouldn't allow insurance companies to jack up rates. But we should take a step-by-step, incremental approach to health care reform instead of gutting Medicare, as you have talked about up here, to create a new government entitlement program. That's what we're saying on this side, and it seems to be falling on deaf ears on the other side of the aisle.
I know my colleague from Mississippi wants to make a comment or two here, but may I ask, Mr. President, how much time is remaining for our side?
7.5 minutes.
Thank you.
Well, if I could just maybe take 1 minute of that time, and then the gentleman can wrap it up. I want to emphasize what a devastating effect these Medicare cuts are going to have on rural America. And once again, I want to quote some of my colleagues from the other end of the building because it shows the bipartisan opposition that we have against these cuts from rural America. Mike Ross, a Democrat from Arkansas, said with more than $400 billion in cuts to Medicare, it could force many of our rural hospitals to close. This is a Democrat, providing less access and care for our senior citizens. Representative Larry Cassell of North Carolina, from the day I announced my candidacy for this office, I promised to protect Medicare. So he voted no on the bill in the House of Representatives. Ike Skelton said proposed reductions to Medicare could further squeeze the budgets of our rural health care providers. And finally, Representative Boucher, a senior Democrat from Virginia, said the plan could place at risk the survival of our region's hospitals. Unless these Medicare changes are taken out of the bill, this bill devastates health care for senior citizens in rural America, and I thank my colleague for yielding me the time.
Thank you very much. And I'd like to just use the remainder of our time to speak for a minute about what do the costs, what does this bill do to different costs in our country? I think the point that we've made in this colloquy at this point is that after the votes that we just took, let no one be confused, the $464 billion of cuts to Medicare remain in the bill. But let's talk about the question of the cost curve. There's been a lot of talk about what we have heard to become known as the cost curve. And it's been said by everybody that we need to bend the cost curve down. And some are saying that this bill bends the cost curve down. Well, which cost curve are they talking about? Are they talking about the size of government, the growth of government? No. If you take the first full 10 years of the growth of spending in this bill, which, by the way, is delayed for 4 years, if you start when the spending really starts and take the first full 10 years of spending, the new spending, the growth of government, is about $2.5 trillion. I don't see how anybody could say that that cost curve is bent down. It is skyrocketed up. Well, would it be the cost of health care, which I think is the cost curve Americans are thinking about? Health care insurance and health care, the quality of health care that's provided. Well, CBO just came out with its report that analyzed that issue, and there are a number of independent groups that have analyzed it, and they all pretty much say that it's not going to reduce the cost of health insurance. It's not going to reduce the cost of health care. In fact, for the neediest in America, those who are in the individual market, it will drive the cost of their insurance up, and not by just a little bit, by around 10 to 13%. And for those in the small group area, it'll drive theirs up not as much, by about 1 to 3%. And for those in the large group area, there's a possibility that theirs might taper off a little bit. The estimate is somewhere between 0 impact and 2% reduction. But is that what we're talking about in America? 30% of the people in this country seeing their health care insurance costs go up, and the rest seeing them remain basically stable? That's not the cost curve reduction that I thought Americans were talking about in health care reform. So then what other cost curve could they be talking about? Well, there's a lot of talk about the deficit. And sometimes they try to shift away from the cost of health care to the cost of the bill to the federal, to the people in America. And they say that the deficit is reduced. Well, how can you say that? There's only one way you can say that, and that is if you accept the budget gimmicks in the bill, if you raise taxes by around $500 billion, and if you cut Medicare by $464, then you can say that this massive expansion of government is somehow covered and that the deficit won't grow. Well, I think we've talked about the Medicare cuts part of this. We're going to talk about the tax increases, which are hundreds of billions of dollars of new taxes in the future. But what did I mean when I said that you can only say the deficit goes down if you accept the budget gimmicks? This bill starts the collection of revenues and the cuts out at the front end, but doesn't start the spending for 4 years. So you have 10 years in the 10-year window that you're looking at. You have 10 years of revenue and 6 years, basically, of spending. And sure, if you only count 6 years of the spending side of the bill against 10 years of its collection side, you're going to be able to make that deficit look a little better. In addition, there are major expenditures that we all know are going to have to be done in healthcare, like the SGR fix for physician compensation in Medicare, that are not even in the bill. An expense that we know over 10 years is around $200 to $250 billion of extra dollars. Simply not there, not counted. Well, if you want to show a deficit reduction, you certainly want to leave out of your bill a lot of the spending that you're going to do in the future. It's gimmicks like these, it's tax increases, and it's Medicare cuts that allows one to say that the deficit goes down. The reality, again, in conclusion here, is that this bill will increase the growth of government by $2.5 trillion for a full 10-year measure, increase taxes by hundreds of billions of dollars, cut Medicare by hundreds of billions of dollars, create a federal insurance company, create massive federal controls over the healthcare economy, push the neediest of the uninsured not into an insurance policy, but into a failing Medicare system, and push an unfunded mandate of tens of billions of dollars onto our states. Mr. President, that's not the kind of health care reform we need. And as my colleague from Nevada indicated, there are reforms that do make a difference, that will reduce the cost of health care, that will cut down the cost of the spiraling costs of health care insurance, and will not require us to have such an intrusion of the federal government into the management of our economy. It's time for us to slow down and start step by step to address the kinds of reforms that will reduce the cost of insurance and the cost of health care, and that will help us to increase access to quality care in America. We can do it, and we have a number of very good ideas on the table that we will be exploring in greater detail in future days as well that will help us to do it. And with that, Madam President, I reserve the balance of our time.